nurses and midwives. I'll be talking about the acceptance of papillomavirus vaccination. He's a retired nurse, and I remember that during my growing up days, it's rare to find a male nurse. Now I'm trying to imagine during his days of practice, how many male nurses were there? I mean, really, welcome on the program, Alaji.
Thank you. Good morning.
Good morning. Ramadan Kareem. So, I asked a question about not having too many male nurses while I was growing up. Yes, we have them now, but I know how it was then. And then your days, I know it would have been worse. What was it like being a male nurse?
Thank you. Being a male nurse, when I enter into nursing profession, it's like a strange thing.
Wow.
And when going by way of statistics, we will say less than 5% of the admission into the school of nursing and midwifery are male. The rest are usually female. Not until the present that there is a bit increase in the number of male admission into the school of nursing. And for so long, there were no admission into the school of midwifery for male. But today, the new policy has also accommodated male doing midwifery courses. So by now, the statistics is still very low. We say less than 10%. Less than 10% of those recruited into nursing profession are male. Whereas global trend and regulation does not have gender bias into nursing profession. You can be male, you can be female, you'll be trained and practice successfully like in any other healthcare profession.
Okay, so we're talking about the acceptance of the HPV, that's the vaccine, and what exactly is the vaccine for? And when we talk about acceptance, what do we mean? Is it the rate at which Nigerians have come to accept taking that vaccine? Is it that before they don't like to take it? I mean, just tell us what it entails.
Human papillomavirus is a product of many researches over ages, attempting to eradicate the occurrence of cervical cancer. Cervical cancer being one of the very many cancers that human papillomavirus can cause, because human papillomavirus can cause oropharyngeal cancer, it can cause genital warts, it can cause vaginal cancer as well. But as for cervical human papillomavirus, it is a form of development out of research to ensure that we keep the body of an individual that takes the vaccine to be able to equip itself with defense mechanism. The immune system are equipped, and then they are ready to fight the infection of human papillomavirus into the body. It is true that it is not every person that has contact with human papillomavirus that actually get down having cervical cancer, because even in Nigeria as of present, we have up to about 12,000 people that contacted this human papillomavirus yearly, and very high percentage of them will eventually develop a cancer, and it is a very debilitating condition, because when you talk about cancer, we know it's not like treating malaria or treating any surgical situation. So it is very, very dreaded, and the burden of the disease is high, not only on the person that is affected, the people in the community. We also pity this person because of the symptoms, the manifestation, and the crisis that the person that is affected goes through. It is also necessary to note that with this safe device, which is the vaccine, the type we are using in Nigeria today is Gardasil, because there are some other forms of HPV vaccine. The Gardasil is very effective, safe, and it keeps the body with immune system. that will make them not to break down. At least 90% of anybody that has taken the HPV vaccine are successfully prevented from having cervical cancer. It is also necessary to say that even those of us that have not shown any symptom, it does not mean that we have not contacted this papillomavirus one time or the other, but the body defense mechanism has been able to combat this effect, and therefore the person will not break down having cervical cancer. The statistics is very alarming that when we are talking about Nigeria, when you look at how it occurs, about 1/3 of whatever of the population come across human papillomavirus daily, and about 2.2% will die of this cervical cancer in a day in Nigeria. So it's very alarming because cervical cancer has become second largest killer of individuals, and unfortunately it attacks the women of childbearing age, and that is why every organization that is interested in the healthiness of the nation are working together. Hands are on deck. Doctors, nurses, researchers, scientists doing research, then people that are on the field are mobilizing heavily for the uptake of this vaccine, based on what we know about this vaccine to be safe, very effective, and then it does not speak against any faith. Both the scripture of the Christian and that of the Muslim encourages us to keep our body to prevent illness. And anybody that does anything contrary is seen as somebody who is willingly killing him or herself, either instrumentally or in a piecemeal that will eventually lead to blaming oneself.
So it is safe to say that it is acceptable. It's not a religious, whether religiously or what. I mean, it doesn't matter what religion you practice. Okay, quickly, I want to ask you: is there like an age range? You know, for children, lots of them to take immunization and everything. Is there a particular age range to take this vaccine, or I mean, what's the process?
In any healthcare services, we will have the targeted population, and the people that are very important, priority that should be given priority attention to today are female girls of about 9 years. Why 9 years? Researchers have shown that most of our girls get exposed to sexual intercourse early in life. But with all researches and studies that have shown, not many up to 9 years are exposed to sexual intercourse, because human papillomavirus means of transmission is skin to skin, and mainly by sexual intercourse. As a result, the study shows that if we are able to immunize a child before the first contact of sexual intercourse, some people may be lucky, it may be enjoyment, and that's the end. But some people, the very first contact, they have incurred the risk of the papillomavirus. So the study have shown that if you are immunized before the first exposure, you have chances of about 90% or even 95% of not contacting this human papillomavirus infection, even more than 10 years to come. So the government are investing in the priority population that will make us to be free of human papillomavirus infection that can either lead to genital warts, oropharyngeal cancer, vaginal cancer, and cervical cancer. More so, that is the leading cause of death. Second leading cause of death as a case of cancer, not only in Nigeria, even globally, but that of the developing country, where some other factors can also aggravate the development of these diseases. It is more.
So is the vaccination free?
The vaccination is free for now for girl child of 9 years. Other people can still be vaccinated, but they have to be responsible financially for the cost of the vaccination.
And how affordable is, and when you say other people, it means that
age bracket?
Is there an age bracket? And how affordable is this vaccine for other people, especially with the fact that it is for women, you know, and cervical cancer, genital warts are not things to joke with?
Well, the belief that this vaccine is mainly for the women now does not rule out male also having issues that can arise from human papillomavirus. A man can also have pineal cancer, so it's not the, but the situation is that the people that it's affecting more, studies have not shown that pineal cancer kills as much, but cervical cancer has been implicated to lead to many deaths. And the age that we said cervical human papillomavirus vaccine can also still be taken by women of childbearing age up to 45 years, up to 50 years. But as regards the safety, we have talked about that. Affordability, it's there. Though not as paracetamol or Amita, but it is still available. Affordability depends upon the class.
It's relative.
Yes, it's relative. Socioeconomic class of I, when you go to a pharmaceutical company and they say a drug costs 50,000-70,000 naira, to some people it's nothing. But when you go to a low socioeconomic class, that thing can be a life struggle to get it known. And that is why many organizations are coming in now to ensure that we continue to have this donation of this free vaccine, and for people to take up the advantage. If you meet the age bracket that the government is giving free today, if about 2 years ago it was limited, it was extended to 9 years to 14 years. People do not take the vaccines then. Many people were fooling themselves then, maybe because of lack of information, education, willingness, or because of misconception. Human papillomavirus will depopulate Nigeria. It will cause, eventually it will cause death. Something will kill us. But as of this year, not many people came out. But today, many organizations, the state government, the international agencies like Pathfinder, some NGO basic, the local NGOs like Family Health Initiative of Ogun State are coming together to ensure that we mobilize and we ensure that if you take it at the right time, then we are free of millions of billions of naira burden economically that cervical cancer could have caused. So it's available. People can get it, but it depends upon
your class.
Let's talk about the reaction to the vaccine, because I remember how I reacted to the COVID-19 vaccine. I may not remember how I reacted to other vaccinations when I was a child or a baby, but I know how my daughter reacted to those, vaccinations. So what's the reaction like, so that as a parent taking their young daughters to these healthcare centers to get this vaccination, so they can be prepared of what to expect after the vaccination?
We thank God for the quality of the vaccine, this Gardasil that we are receiving in Nigeria, because there has not been any recorded fatal reaction. And let me reassure the masses, or all of us, that as those people, the human papillomavirus vaccine is not given by any other person other than skilled professionals. So they look out for those who can react adversely to human papillomavirus vaccine. Somebody that is debilitating, very sick, will not take it, especially maybe with HIV infection. But for general reaction, we have, even when we are going out, when they are immunizing, we have a consideration of adverse effects following the immunization, and it is for every antigen or immunization. But as for this vaccine, there are very slight things that happen. One of it is probably headache, pain at the site of injection, or swelling at the site of injection. But in case there's any other reaction, because there's what we call the idiosyncrasy in pharmacological studies. This is the way carrier will react to one drug, they may not react like that. So in case of that, we always prepare the mind of the person, and one of the things the health workers will do is that it's not just any vaccine that you just give on the road like that. You position the beneficiary, the person who is going to take the vaccine, in a well comfortable position, so that should, in case there's anything in form of shock, you'll be able to manage. But there has not been any recorded. I'm not saying that there could not be, but most of the reactions are just mainly maybe pain at the site of injection, maybe redness at the site of injection, and slight headache. And that is why healthcare HPV vaccine vaccinator goes out with some basic drugs that can be used to counteract the effect of these side effects. So it's basically, in fact, the safety, because even paracetamol, you talk of all these iron drug we use, even folic acid, even water, you can have some slight body reaction to it.
You talked about misconception earlier. You said it was one of the reasons why a lot of people did not come out at that time when it was first being given to children within the ages of 9 to 14. Now, talking about misconception, what is the government doing? What is the medical bodies doing? The nursing, association, what are they doing with regards to this misconception? Are there sensitization? We've invited you, you've come out to talk, that for those people that maybe don't have access to TV, the market women, people that are currently not watching, what are the plans, or what is the plan, ongoing plans to sensitize them on this HPV vaccine?
Thank you. One of the worst things that could happen to an individual, if you are not informed, is better. But if you are misinformed, it's another thing to the negative side. Those misconceptions, the myths about this vaccine include that they want to kill you if you receive this vaccine. Then instrumentally, they give number of years, that we give you about 3-4 years, you are going to die, or that you will not fecundity or fertility to depopulate. It was also spread like that. Some religious institutions believe that it is like introducing something that is anti-Christ or anti something like it that is inherent with genes to your body, that it will affect your spiritual life. But like you have mentioned, the government noted this, and that is why right away from WHO, World Health Organization, and some other relevant bodies to health, there is massive education, printing pamphlets, going to the radio. Number one, conducting research. All these things they are saying, what can we find out of it? And people even up to today are still in the lab, in the clinical lab, doing researches. That is for the international organizations. For the Nigerian government, they are going all out to ensure that all healthcare professionals are prepared to answer some forms of curiosity from the public and correct misinformation about this. For professional associations, Nigerian Medical Association, National Association of Nigerian Nurses and Midwives, the Pharmaceutical Council of Nigeria, all of us have the mandate. Apart from the fact that we work for government or whatsoever, we know that one of our responsibility is to be answerable to the mind and the wellness of the public. So we are all out. Many of these organizations print pamphlets, they go on outreach programs, they pay very special visits to people in government and people who are non-governmental organizations but that have they are spokesperson, they are key person in the environment. So also some basic non-governmental organizations, both the local one and international one, are doing very wonderfully well about this. So also some of us who are retired professionals have taken it upon ourselves to go all out. For example, I started like HPV vaccine champion, of which many people are involved. In this Ogun State, Baba Obasanjo has been decorated as Grand Champion. Olowu was decorated as Grand Champion. The Honorable Commissioner was decorated as Grand. All what this means is for us to put our house in order to educate the people. Now, we as champions who are professionals, we go all out. In our churches, in our mosques, in our gathering. I'm a unionist. If I attend any union program, I will make it a matter of discussion. And we do go on outreach programs. We do campaign. For example, around January, February, we were in some local government doing campaign. We were in Ado-Duota local government, Odeda local government, Ogun-Waterside local government, and some other local government like that. And it's showing, for example, data showed that before the introduction of people going out to correct this impression, the vaccine coverage in Ogun State was as low as maybe 30-something percentage. But what we have in 2026, from end of 2025, with the actions of champion going all out to campaign, to give evidences, the percentage has risen to about 75%. And we know that before the next quarter, our target is to reach about 90%. So we are not sparing any chances to educate the people, and we entertain information at any point in time. There are lines people can call to confirm any information, and all health clinics are equipped with this vaccine. That is its accessibility. So when they go to some of these health clinics, what they do first is to ask the person, how much are you aware about HPV vaccine? If the person made a mistake, we correct from there. So all stakeholders are making efforts to ensure that people are convinced about the disability and the advantage of this HPV vaccine.
Okay, we have to go, but before we do, quickly, maybe in 1 minute, I want you to advise those that are watching, especially parents, because at the end of the day, a 9-year-old doesn't necessarily have a say until maybe in the future when she realizes that the parent had, made that decision for her not to get vaccinated. So I really want you to give your quick words to parents and guardians and how important it is to allow their words get vaccinated.
For our people at home, we have a singular opportunity to secure the future and to relieve endless pain of our children. When it occurs, all amount of motherly care, fatherly care, financial support will not be able to relieve the children this calamity. As a result, we have a singular opportunity now to accept this vaccine, make your children available to take this vaccine, and make sure that you invest in their future, their education, their economy, their well-being will be safeguarded if you are able to convince them. Let me also say that there are some children whose parents may not want to take. We, the health workers that are on the field, these children come to us. They say, please give this vaccine to me. I want to take this vaccine. We have been seeing that example. But we convince them that we must convince you and your parents. So also even the male counterparts are coming up today. You don't want us to live? You are giving only the female counterparts? Yes. Why don't you give to us? And we reassure them that you can also take. But Nigerians as of present, there are some countries who give both male and female. Because where the issue of sexual intercourse and the transmission of HPV virus is coming from will be from the man to the a woman. So also as an advice, all adults should go for tests, HPV test or the pap smear, to know that you are not, because this vaccine is clear, it's not for curative measure, it is preventive. And as a result, we need to join hands to, even if you are free today, that does not mean you'll be free tomorrow, especially people with multiple partners.
Thank you very much.
Thank you.
Thank you so much. Alhaji Abdurrafiu Adeniji, the former national president of the National Association of Nigerian Nurses and Midwives. At the end of the day, prevention is better than cure. So why not just prevent yourself? Trending is up next. Please stay with us.